Hey, my name is Rachael Duncan. I live in Salida, Colorado. I am a pharmacist and I am the program director for Moms Plus. Moms standing for Maternal Overdose Matters, which is really just a recognition that the driver of maternal mortality in both Colorado and around the nation continues to be suicide and overdose. And really just wanting to help change that. You know, Moms Plus is really all about helping all of the birthing hospitals in Colorado provide equitable access to treatment and recovery for patients and families affected by substance use and use disorders. Yeah, Moms Plus is a program through Impact Behavioral Health and CPCQC that helps birthing hospitals provide equitable access to treatment and recovery for our perinatal patients and families affected by substance use and use disorder. I think that what this does is really hopefully create the birthing hospital as the place that these types of patients want to go to access not only treatment for a very treatable chronic disease state like substance use disorder, but also access perinatal care. We know historically that many patients are not accessing care for either of these things due to the stigma that has been associated with substance use and use disorder. And so we're really trying to change that and make sure that birthing hospital is the number one place, the first place that they think of to go and receive that wraparound care. And that we try to change our attitudes in these hospitals and as frontline healthcare workers from an attitude of mandatory reporting to an attitude of mandatory responding, and making sure that those affected in our communities know that and that they want to go and access appropriate care at those hospitals. Yeah, Moms Plus, I think, is really impacting communities and hopefully opening up the doors of our birthing hospitals. Again, it's just that go-to place for pregnant and parenting patients that are affected by substance use and use disorders. I think historically it's been the last place that these patients have wanted to go just due to that stigma and due to that fear of their child being taken away. We're so fortunate to live in a state like Colorado where those laws are much more nuanced, and helping hospitals understand that intersection and making sure that they are having welcoming, opening arms to patients that have historically been marginalized and stigmatized, and getting those patients into the doors that I think will hopefully change the narrative and start breaking the cycle, kind of breaking that generational transfer that we see when it comes to use disorders, breaking that cycle and getting patients and families into recovery. And you know, the number one focus is on that mom and on that pregnant patient, but also the trickle down effects of doing that, both within that family, on that child, and in that community are just huge. And so we're already starting to see those effects at our pilot site, which was Valley View Hospital in Glenwood Springs. And now to be able to expand that to 10 other birthing hospitals in the state has really been such a joy. And I'm so excited to see what this round of pilot sites will do. Moms Plus and our work through Impact BH and CPCQC is all about working with other organizations and collaboration. One of our pillars is connection, and that's connection to mom, baby, family, the dyad, but also connection within the community and helping birthing hospitals really reach out and create first a connection with a community of patients that use substances and maybe have a use disorder. And that's connection number one. You got to get those folks in the door to receive treatment and to receive perinatal care. And so we help them do that outreach into those communities. And then also what you do in the hospital is only so good as what can be continued long term when that patient is discharged. And so helping these birthing hospitals create connections within the community, both with other healthcare providers to be able to continue treatment, but also with other community resources that are maybe even more important than the medical resources, right? So social services, recovery support specialist, making sure we're addressing all the social determinants of health, making sure that people can get to their appointments and get plugged into so many other great community resources. So yes, definitely a lot of collaboration going on with Moms Plus. Yeah, my advice to others would be that whenever you're trying to integrate behavioral health services and substance use and use disorder services into any type of healthcare or any setting really, is to include those with lived experience at the table. Those patients that are in recovery are thriving, they're living out loud, and those parents and moms in recovery are thriving, but they probably didn't get there any thanks to those of us in healthcare, and there's a reason why. We've not been doing it correctly for the past several decades, and so we need to start having those peers at the table with us, making these types of decisions, putting these guidelines and protocols and policies into place, changing legislative and regulatory barriers, and then just really looking at best practice and processes that are actually going to be successful. We have to start including those with lived experience to ask them what was successful for you and why, and tell us how to do this better. So that would be the biggest piece of advice that I have. Thanks.